Coming up in this episode, that's a condition caused by dislodged otoliths or crystals, you might colloquially say. And I've put them, if you look very closely, in the posterior canal because that's the most common cause of BPPV and therefore the most common cause of vertigo overall. Hello, everyone, and welcome to the next installment of Risfeld Neurology Education, a not for profit project exploring all areas of clinical neurology. I'm your host, Tom Risfeld, a neurologist, epileptologist, and neurophysiologist and neuromuscular specialist, and also a physician, philosopher, and bioethicist. This episode is a bit of a silly one and a bit of a fun one, and a very short one, and it's titled Explaining Our Logo. I didn't know where else to put this, so I thought I'd just do it as a standalone rather than putting it in the introduction and making it too long. It's only one slide, it's not going to take long. But this logo is my pride and joy, and I'm very proud of it. And I want to explain it to you all because it took me a long time. And there's a few little insights hidden away as well. So this will probably work better if you're watching this on video as opposed to listening to it on audio. But I will do my best to describe what I'm seeing as I go along. And before we get into it, a legal disclaimer: the content in this episode and in the Risfeld Neurology Education Project as a whole is for educational purposes only. So there are 8 different, somewhat complex logos which are all arranged in a circle. The first one is a face in sagittal plane with electrodes on the head for an EEG. And then you can see the cerebral activity on each of the EEG leads, and you can see the field. And it's not a spike, but there are 2 sharp waves which are demonstrated, and that's to symbolize epilepsy and seizures. I couldn't quite manage to do a good logo and a good image that didn't use an EEG cap, but of course, not using EEG caps is preferable. It's much better in terms of the quality of the EEG recording that you obtain to actually glue or stick the electrodes directly onto the scalp rather than using a pre-prepared cap. The second one is for neuroimmunology, and again, it's a sagittal image, but this time it's a midline or parasagittal MRI with a T2 flare, and it demonstrates Dawson's fingers and other typical demyelinating multiple sclerosis lesions anatomically. So for this, I got a real MRI in a flare sagittal, and then I put it through AI to dehumanize it and make it look more like a logo, so it's not actually a person's imaging. And then I've put in lots of Dawson's fingers, so they're your callosal demyelinating plaques. Then I've got a few little juxtacortical lesions in the frontal lobe, anteriorly and posteriorly, and one in the parietal lobe. And then I've got a few deeper lesions in the brainstem, so one at the base of the midbrain, one in the pons, and a few in the medulla, and a few in the cerebellum. And then I've got 1 or 2 small demyelinating plaques in the spinal cord as well. And they're the 4 key radiologic areas that are considered when trying to make a radiological diagnosis of multiple sclerosis. The third image is to represent movement disorders, and I chose Parkinson's disease here, idiopathic Parkinson's disease, I should say. So I've got an icon of a man with a stooped posture, typical of Parkinson's disease, with some upper limb tremor present. And I've chosen a tulip, which I learnt was the symbol for Parkinson's disease, but I've placed it upside down and the man's using it as a walking stick. The fourth image is again in the sagittal plane, and it is an icon-styled image of a patient's head, and this patient has a headache. They have a area of pain originating from the temporal region, indicated by the red flash and the electric shocks, and there's a botulinum toxin injection being administered to represent migraine, one of the typical primary headache syndromes, and one of the advanced therapies for that condition. Fifth image is the image for neuromuscular conditions, and for this I chose carpal tunnel syndrome. So I've got the volar aspect of a patient's right hand, and there's pain and a degree of sensory loss or disturbance in the distribution of the median nerve. So that's affecting the first, second, third, and half of the fourth digit, with sparing of part of the palm, because the palmocutaneous branch is spared in carpal tunnel syndrome. And then this patient is undergoing diagnostic testing with nerve conduction studies. So the stimulator is being placed over the median nerve at the wrist, just proximal to the flexor reticulaculum of the carpal tunnel. And then the recording electrode is being placed over the bulk of the muscle belly of the APB, the abductor pollicis brevis muscle. And the reference electrode is being placed over the tendon of the muscle. So basically on the first digit at about the interphalangeal joint. And I find that the electrodes stick on better when you put them there. The sixth image is to represent neurootology. And so I chose a vertiginous patient, again in sagittal section with an icon form of a head, with lots of ellipses and stars and crosses to indicate that the patient is dizzy or vertiginous. And I've also included a representation of the semicircular canals. And I've chosen this patient to have benign paroxysmal positional vertigo, BPPV. And that's a condition caused by dislodged otoliths or crystals, you might colloquially say. And I've put them, if you look very closely, in the posterior canal because that's the most common cause of BPPV and therefore the most common cause of vertigo overall. I've also included neuro-ophthalmology in this image by indicating an eye with an ophthalmoscope. And you can see, if you look closely, a nice retina if you look through the eyepiece of the ophthalmoscope. This image is an image representing cognitive disorders and dementias. And so I've chosen a 3D sagittal representation of a brain of a patient with Alzheimer's disease in icon form. And you can see that it's slowly floating away in a posterior predominant pattern because we know that in Alzheimer's disease, the atrophy is posterior predominant. So the posterior parietal and temporal and occipital regions classically. And I was pleased in some ways to learn that there was a second flower that was relevant to symbols in neurologic disease. And in the case of Alzheimer's disease, it's the forget-me-not flower. And I'd seen some other images online of people using pieces of jigsaw puzzles floating away or leaves floating away, but I thought it would be quite fitting to use the forget-me-not flower itself to represent the parts of the brain which are floating away. So that's what the image demonstrates. And finally, the last icon is one to represent cerebrovascular diseases and stroke. So, of course, I chose a circle of Willis in coronal view, demonstrating a large juicy thrombus in the mid to distal M1 branch of the left middle cerebral artery, which is unfortunately for this person causing an acute ischemic stroke. In addition to this, there is a tendon hammer and a tuning fork on top and below of the text in the logo. And this is to represent the tendon hammer and the tuning fork being the motor and sensory components of the clinical examination, which are the foundation and the beginning and the end of any clinical assessment. So please don't forget your roots. And lastly, one thing to note is that the background colors for each of the images are not random. I was pleased to learn that there are ribbons that are used for the international or annual awareness days for each of these conditions, and these ribbons each have a color. So, for example, epilepsy uses a purple ribbon, so I've used a purple background. MS and neuroimmunology uses orange. Parkinson's disease is gray or silver. Migraine and headache and stroke are both red. Neuromuscular is blue. Neurootology is yellow. And again, cognitive disorders and dementias are purple. So that's why I've chosen the colors that I have. I've always enjoyed visual art and creativity, but this was my introduction to digital art and artificial intelligence assisted creativity. So you'll have to cut me some slack, but I did want to describe what my logo means, and hopefully you learned a thing or two along the way as well. So thank you for tuning in to this silly, quick episode. Please like, comment, and subscribe. Please visit ourneurologyeducation.org, our website, for all our media formats and additional content. And please find our video presentations on YouTube, our audio podcasts wherever you listen to your podcasts, and join us on your preferred social media platforms, all located at the domain R Neurology Education, with the exception of X, which is at R Neuroeducation. And email us on contact@rneurologyeducation.org for any questions or queries that you have. From cortex to curiosity, this has been Risfeld Neurology Education. Until next time, keep calm and synapse on.